Did you know there are several different stages of Alzheimer's? 7 stages of Alzheimer's. Stage 1. No impairment, normal function. The person does not experience any memory problems. An interview with a medical professional does not show any evidence or symptoms of dementia. Stage 2. Very mild cognitive decline. The person may feel as if he or she is having memory lapses, forgetting familiar words or the location of everyday objects. Very mild decline in stage 2. The person will still do well on memory tests, and the disease is unlikely to be detected by loved ones or physicians. Stage 3. Mild cognitive decline. Mild decline. At this stage, the family members and friends of the senior may be noticing cognitive problems. Performance on memory tests are affected, and physicians will be able to detect impairment cognitive function. People in this stage will have difficulty in many areas, including finding the right words during conversation, organizing and planning, remembering names of new acquaintances. People with this stage may also frequently lose personal possessions, including valuables. Friends, family, or coworkers may begin to notice difficulties. During a detailed medical interview, doctors may be able to detect problems in memory or concentration. Common Stage 3 difficulties. Noticeable problems coming up with the right word or name. They may have trouble remembering names when introduced to new people. They may have noticeably greater difficulty performing tasks in social or work settings, forgetting material that one has just read. Losing or misplacing a valuable object. Increasing trouble with planning or organizing. Stage 4. Moderate cognitive decline. Symptoms are forgetfulness of recent events, impaired ability to perform daily tasks, forgetfulness of one's past. This is a moderate decline. In this stage, clear-cut symptoms of the disease are apparent. People with stage 4 of Alzheimer's have difficulty with simple arithmetic, have poor short-term memory. They may not recall what they ate for breakfast, for example. Inability to manage finances and pay bills, may forget details about their life histories. Stage 5. Moderately severe cognitive decline. May be unable to recall their address or phone number. Need help choosing the proper clothing. May not require assistance with toileting yet. Stage 6. Severe cognitive decline. Lose awareness of recent experiences. Lose awareness of their surroundings. Trouble remembering names of loved ones and caregivers. Need help dressing properly. More restless nights or sleep disturbances. Need assistance toileting. May begin to wander or get lost. People in this stage need constant supervision and frequently require professional care. Symptoms include confusion or unawareness of environment and surroundings, inability to recognize faces except for the closest friends and relatives, inability to remember most details of personal history, loss of bladder or bowel control, major personality changes and potential behavior problems, the need for assistance with activities of daily living such as toileting and bathing, and they may wander. Stage 7. Very severe cognitive decline. Severe of late stage. In the final stage of this disease, individuals lose their ability to respond to their environment, to carry on a conversation, and eventually to control movement. They may still say words or phrases. At this stage, individuals need help with much of their daily personal care, including eating or using the toilet. They may also lose the ability to smile, to sit up without support, and to hold their heads up. Reflexes become abnormal. Muscles grow rigid. Swallowing impaired. Challenges for caregiver at each stage. Early stage caregiving. You must provide love, support, and companionship. Early stage Alzheimer's people need help with remembering names. They have disorientation, keeping and making appointments, keeping track of medications, planning or organizing, managing their finances, personality changes, decline in grooming. They also have common difficulties that include problems coming up with the right word or name, trouble remembering names when introduced to new people, challenging performing tasks in social or work settings, forgetting material that one has just read, losing or misplacing a valuable object, increasing trouble with planning or organizing. Middle stage caregiving. Use simple written reminders for a person who can still read. Use a calm, reassuring voice, especially when answering repeated questions. Report any changes to the doctor. The patient may experience depression, anxiety, sleep changes, or repetitive behaviors. Communication changes in this stage. They have language difficulties. Daily activities become more challenging for the resident. They may have increased agitation or hallucinations. Late stage caregiving. You can provide care and support through the senses. You need to make them comfortable and preserve their quality of life. The resident may have little to no memory. They are at risk for dehydration. They have increased frailty, disrupted sleep cycle. They are totally dependent on a caregiver. They may have loss of bowel or bladder. Tips for late stage caregiving. Play music. Read books or poems. Look at old photos. Take a walk on a nice day. Give them a light hand or foot massage. Eat their favorite food. Common behaviors may include aggression and anger. Aggressive behaviors can occur suddenly with no apparent reason or result from a frustrating situation. Anxiety and agitation. A person with dementia may become restless or upset in certain places when focused on specific details. Depression. Identifying depression can be difficult, since dementia can cause some of the same symptoms. Hallucinations. Some hallucinations may be frightening to a person with Alzheimer's, while others may involve ordinary visions from the past. Memory loss and confusion. Those with Alzheimer's may not remember familiar people, places, or things in the later stages of the disease. Repetition. In most cases, a person with Alzheimer's is probably looking for comfort, security, when repeating information. Sleep issues and sundowning. Like changes in memory and behavior, sleep changes somehow result from the impact of Alzheimer's on the brain. Suspicions and delusions. Suspicions and delusions firmly held beliefs in things that are not real. They may occur in the middle to late stages. Wandering. Wandering among people with dementia is dangerous, but there are strategies and services to help prevent it. Agitation and aggression. A person with dementia may become restless or upset in certain places when focused on specific details. He or she may become restless, causing a need to move around or pace, or become upset in certain places or when focused on specific details. Causes of agitation: moving to a new residence, changes in the environment, changes in caregivers, fatigue. Tips to prevent agitation: create a calm environment, simplify tasks, get some fresh air or exercise, avoid emotional triggers, monitor personal comfort. What can I do? You can listen. You can reassure. You can modify the environment. You can engage in meaningful activities.